Hi, I'm Anthony Coxon from Simply Health Chiropractic, and today I'd like to talk to you about the latest advances in the treatment of low back pain. Low back pain is a real problem. We know worldwide that there's 540 million people experiencing significant low back pain at any one time. It's the number one cause of years lost with disability, even more so than heart disease and cancer. Now, for most of us, fortunately, low back pain or back pain in general will be a mild type of problem that intermittently comes and goes throughout our lives. For some people, however, it will be severe, debilitating and ongoing, a chronic low back problem. What we do know is that because the nature of low back pain is that it tends to be recurrent, is that quick, short fixes tend not to work. It's far better to look at improving function and improving the way the body works if we're really to tackle the problem of low back pain and disability. As recently as last month, The Lancet, a very prestigious medical journal, produced 3 papers talking about back pain. And what they wanted to do was to show what evidence exists for certain types of approaches to this sort of problem. On the plus side, the things that seem to work for low back pain, number 1 was movement. Simply getting out of the chair and walking or doing simple generalized exercises goes a long way to improving the spine. And this is really important because it's so simple and easy to do. Number 2 was more specific back exercises. Sometimes we need to be more specific in terms of addressing individual weaknesses in the spine. Number 3 was manual types of therapies, the things that chiropractors do all the time, whether it's adjusting or manipulating the spine, mobilization techniques, massage and soft tissue techniques. These tend to be very beneficial. Also on the plus side are the more simple medications, things such as anti-inflammatory medications. They're not the first choice, but they still can be helpful in some cases. Now on the other side, the things that don't have a lot of evidence or don't tend to work well for low back pain include things like the strong medications, the opioid medications. Not only don't they work for chronic low back pain, but they're highly addictive. The other things that can create problems, or at least don't seem to have a great deal of evidence supporting their use, are things such as facet injections, are things such as electrotherapies, which include things like ultrasound, and things such as fusion surgeries. All these either tend to have little evidence to suggest that they work or have poor long-term outcomes. Because most low back pain is not from a pathology, routine X-ray and MRI are also not recommended. So the best approach, if you really want to have a great back, is to work on your function. Get your lifestyle right, get your function right, and you'll end up having a happy back for a long, long time.